Hey, it's me, Dr. G, and welcome back to Friday Morning Rounds. We are all aware that the national health dialogue continues to center around everything COVID-19. Yes, this remains critically important to discuss, but at the same time, we cannot turn a blind eye to other pressing health concerns. Remember that it is never too early and never too late to make substantive changes to improve our health, well-being, or purpose. As a hashtag lifestyle medicine physician, this is the default attitude that I instill in my patients and in myself on a daily basis. A new report from the Lancet Commission on dementia prevention was published on July 30th, and it is worth your time to hear its findings. I discussed hashtag dementia during season 2 of To Your Health with Dr. G, and I encourage you to check out that episode to learn more about the increasing dementia epidemic. You can find a link to it in the post below. Now back to the report. This was an update to the Commission's original report published in 2017. The 2017 report identified 9 modifiable risk factors that were estimated to account for a third of all dementia cases. The newest report now includes 3 additional modifiable risk factors. In total, we know that there are 12 modifiable risk factors that account for 40% of dementia cases. They are as follows. Number 1, midlife hearing loss. Number 2, not completing secondary education. Number 3, later life smoking. Number 4, later life depression. Number 5, later life physical inactivity. Number 6, later life social isolation. Number 7, midlife hypertension. Number 8, later life diabetes. Number 9, midlife obesity. And now we have number 10, excessive alcohol intake in midlife. Number 11, traumatic brain injury in midlife. And number 12, air pollution in later life. Make no mistake, the implications of this new report are huge, especially for the following reasons. Number 1, 50 million people around the world have dementia right now. Number 2, 10 million new cases of dementia are diagnosed worldwide each year. And number 3, by the year 2050, we will be diagnosing 30 million new cases of dementia each year. Here in the US, 1 in 10 people aged 65 and older has Alzheimer's disease, which is the most common form of dementia. Almost 2/3 of Americans with Alzheimer's are women. Black Americans are about 2 times as likely to have Alzheimer's or other dementia, and Hispanics are about 1.5 times as likely when compared to the Caucasian population. Finally, 1 in 3 seniors dies with Alzheimer's or another dementia, and Alzheimer's is the 6th leading cause of death. So, how can we curb our collective dementia risk? Once again, this report challenges us to do better throughout all levels of public health, federal, state, county/community, and individual levels. From a population-based level, the Commission tasks us to prioritize childhood education, implement social public health policies that curb hypertension risk, develop policies that bolster social, cognitive, and physical activity throughout life, assess people's risks for hearing loss throughout life, curb traumatic brain injury risk in relevant settings, implement national and international policies to lessen population's exposure to air pollution, and strengthen national and international efforts to curb exposure to smoking, reduce uptake, and support cessation. For individually targeted recommendations, people need to aim for systolic blood pressure of 130 millimeters of mercury or lower beginning in midlife. Use hearing aids for hearing loss. Limit alcohol consumption and prevent head trauma when an individual is at high risk. Stop smoking, reduce obesity and diabetes by making sure healthy food is available and ensuring the environment encourages movement. And stay active in midlife and later life. One last thing. Since COVID has dominated the global health consciousness, the Commission also took this into consideration and noted that people with dementia are particularly at risk for COVID-19 because of their age, comorbidities, and challenges with adhering to social distancing requirements. There is a lot for all of us to consider here. Stay safe and have a good weekend. Peace out.